Hello everyone, how are you all? I hope all of you are doing well and are healthy, safe at your homes. This is Dr. AASTHA PUROHIT from India, Team UCESCO Africa, and today I am using this platform to spread awareness on COVID-19 or coronavirus globally. So the question is, what exactly is coronavirus? See, coronavirus is a family of viruses which leads to infection in animals as well as in human beings. So it can cause diseases ranging from common cold to severe acute respiratory syndrome. Now the latest coronavirus was discovered in 2019 December, and it led to the discovery of a disease, COVID-19, coronavirus disease 19. That is the cause of the current pandemic situation. So how does it spread? The mode of transmission is through droplet infection, and the droplets can spread from an infected to a healthy person during speech or sneezing or coughing when they do not take proper precautions. These droplets land on certain surfaces and are vital for certain amount of time. So when a healthy person comes in contact with these droplets, they can also get infected. So the various symptoms involved are dyspnea, which means difficulty with breathing, and a fever, then tiredness and dry cough. These are the most common symptoms, and the other symptoms involved includes diarrhea, conjunctivitis, loss of taste sensation, loss of smell sensation, then rashes on skin, then discoloration of fingers or toes, headache and tiredness. So how do we manage and prevent this disease? So the precautions that you should take is social distancing, which is very important, wearing proper face masks and covering your nose and face, half of your face with it. Your nose and your mouth should be covered properly. Then you should, if you're using a reusable face mask, make sure you clean it properly after every use, wear gloves, use sanitizers, and wash your hands properly as many times as possible. Avoid going outside. Try to stay in your homes as much as possible. Then avoid using cash. Try to use net banking or other apps for the money transaction. The question is, what should a person do when the person is not feeling well? So when a person is not feeling well, kindly do not panic. It is very important for you as well as for people around you. Contact the nearest helpline number or the local helpline number in your area, and when people arrive for taking tests, kindly give them your samples, and till the time you receive your test results, make sure that you self-isolate yourself. So the next question is, what is the difference between social distancing, self-isolation and quarantine? See, quarantine is when a person is asymptomatic but they might be exposed to COVID-19 infection, like when a person is traveling from one place to other. They isolate themselves for 14 days, and if they are normal after that also, there are no symptoms, then they can continue with their normal lives. What is self-isolation? Self-isolation is when a person is symptomatic. The person is not feeling well, even if the person feels that the person has not been exposed to COVID-19 infection. The person has to stay away from other people in order to stay healthy, and so that the other people do not get infected from them. They should take rest at their own homes and seek medical help, take proper tests. So the third is social distancing. Social distancing, I think all of you would be knowing. Social distancing is when you go outside, you should maintain proper distance from the other people. So who are the people at higher risk of getting infected? Immunocompromised people. That means immunocompromised are people who have deficient or weaker immune system, like people with HIV/AIDS or chronic illness, or people who have been prescribed immunosuppressants, you have to be extra cautious. Then people who are chronic smokers are at higher risk. So if you are thinking to quit smoking since a long time, this is the right time to do it. Even the elderly people at our higher risk due to weaker immune system. So it is very important to take proper precautions. Now I would like to discuss certain myths that I have heard of. The first myth that I have heard is, if a person is very old and they get COVID-19 infection, they will definitely die, that it is fatal. See, the thing is that they are at higher risk, but this doesn't confirm that they will die. Please don't spread this thing. The thing is that when a person grows old, their immune system weakens. So if they take proper precautions and stay away from the infection, you will be safe. And there are many cases in which the old age people have recovered nicely. The next very common misconception is that people who have recovered from the infection will never get their infection again. No, this is not true. You can be reinfected. There have been many cases. So please pay attention and follow proper guidelines that are given to you. Then the next common misconception is people who are at younger age group will not get infected. No, this is not true. Even you can get infected. So you should also maintain a proper protocol. The next and one of the very biggest misconception that I have heard is that it spreads only by touching. No, it doesn't just spreads by touching. It can also spread, since it is a droplet infection, it can easily be spread from a infected person to an healthy person when through speech, cough, or sneezing, cold. So it is very important for you to take proper precautions. It is very important to maintain your mental health. So kindly stay active, meditate, do yoga, floor exercises, eat healthy food, and channelize your child's energy in a very positive and healthy manner, because they are unable to utilize that energy that they used to do in playing or on the field or in school. So it is very important. You can read them stories or sing them songs or do certain activities like playing. I hope this video was very useful to all of you, and I was able to cover most of the topics that you wanted. I hope that all of you will follow the proper guidelines and protocols and will be healthy, safe at your homes. Thank you to all of you. This is Dr. AASTHA PUROHIT from India, from Team UCESCO Africa. Thank you so much for listening.